Here's a subtlety I noticed before diving in, and it might tell you something you didn't know. Cancer very rarely announces itself with a scream. It usually starts as a whisper, a little tiredness you blame on a bad night's sleep, a tiny mole that looks slightly different, but not different enough to worry about, a stomach that feels off for a few weeks, which you write off as stress or bad food. Most people who are eventually diagnosed with cancer can look back and remember a moment months earlier when their body was quietly trying to get their attention. They just didn't know how to listen. By the end of this video, you're going to know exactly what to listen for, and I promise you, some of these signs are going to surprise you because they don't look anything like what you'd expect from something as serious as cancer. Before we go further, let's get one thing straight, because this matters more than almost anything else in this video. Having one of these symptoms does not mean you have cancer. In the vast majority of cases, these signs turn out to be something completely harmless: a stomach bug, stress, a vitamin deficiency, aging, hormones, or nothing at all. The purpose of this video isn't to scare you into thinking every ache is a tumor. It's the opposite. It's to help you tell the difference between this is normal and this is worth getting checked, so that if something ever is serious, you catch it early when it's most treatable, instead of late when options run out. Early detection genuinely saves lives. That's not an exaggeration. That's just how cancer works, and it's why this information matters. Let's start with fatigue, because it's the most misunderstood symptom on this entire list. Everyone is tired. We live in a world of late nights, early alarms, and never-ending to-do lists, so tiredness feels like background noise, something you're supposed to just push through with more coffee. But there's a difference between "I'm tired because I didn't sleep enough" and a specific kind of exhaustion that doctors pay close attention to. Fatigue that doesn't improve with rest, that comes on gradually over weeks, and that starts interfering with things you used to do without a second thought: climbing stairs, finishing a workday, even holding a conversation. This kind of persistent, unexplained fatigue can be linked to several cancers, including leukemia, colon cancer, and stomach cancer, often because the cancer is quietly affecting blood cell production or causing slow internal blood loss you can't see. The key word here is persistent. A tired week isn't a red flag. A tired month with no clear explanation is worth mentioning to a doctor. Now here's one that catches almost everyone off guard: unexplained weight loss. If you've ever complained about how hard it is to lose weight, this next part might sound almost unbelievable, but losing weight without trying is actually one of the more consistent early warning signs across several types of cancer, including pancreatic, stomach, esophageal, and lung cancer. We're not talking about the 2 or 3 pounds that come and go depending on stress or your last vacation. We're talking about losing 10 pounds or more without changing your diet or exercise over a period of 6 months or less. The reason this happens is almost poetic in a dark way. Cancer cells can hijack your body's metabolism, causing it to burn through energy and break down muscle and fat, even while you're eating normally. So if a friend jokes about wanting weight loss to be this easy, and it's happening to you without effort, that's not a compliment your body is giving you. It's a message. Let's talk about your skin for a moment, because this is the one most people genuinely believe they'd notice immediately, and yet it's one of the most commonly missed. Skin cancer, especially melanoma, is one of the most visually detectable cancers there is, but only if you know what you're actually looking for. Doctors use something called the ABCDE rule to spot dangerous changes in moles. A stands for asymmetry, one half of the mole looking different from the other. B stands for border, edges that are blurry, notched, or irregular instead of smooth. C stands for color, a mole with multiple shades of brown, black, or even patches of red, white, or blue. D stands for diameter, anything larger than about 6 millimeters, roughly the size of a pencil eraser. And E stands for evolving, a mole that is changing in size, shape, color, or texture over time. That last one, evolving, is actually the most important, because a mole that's been exactly the same for 20 years is far less concerning than a new mole that appeared out of nowhere and is changing month to month. Most of us have moles we've never really looked at twice. This is your reminder to actually look. Here's a curiosity gap worth sitting with for a second. One of the earliest warning signs of colorectal cancer isn't pain, and it isn't even something dramatic. It's a change in your bathroom habits, something almost nobody wants to talk about, which is exactly why it gets ignored so often. Persistent changes in bowel habits, whether that's diarrhea, constipation, or a change in the consistency of your stool that lasts more than a couple of weeks, can be an early signal. So can blood in the stool, even in small amounts, or a sensation that your bowel isn't fully emptying even right after you've gone. Colorectal cancer rates have actually been rising among people under 50 in recent years, which is why doctors have been pushing so hard for people to stop dismissing these symptoms as just IBS or just something I ate, especially when they don't go away. This is uncomfortable to talk about, I know, but the discomfort of a conversation is nothing compared to the value of catching something early. Let's move to something that affects both men and women, but shows up differently in each: unusual lumps or thickening. For breast cancer, this often means a new lump in the breast or underarm, changes in breast size or shape, dimpling of the skin that looks a bit like an orange peel, or unusual nipple discharge. And here's something that surprises a lot of people. Men can get breast cancer too. It's rare, but it happens, and because men almost never think to check, it's often caught later than it should be. For lymphoma, one of the earliest signs is often painless swelling in the lymph nodes, in the neck, armpit, or groin. A lump that doesn't hurt, doesn't go away after a couple of weeks, and just sort of sits there. The painless part is actually what makes it dangerous, because our instinct is to worry about things that hurt and ignore things that don't. But painless doesn't mean harmless. Now, a cough. Everyone gets coughs, especially with allergies, colds, or reflux, so this one is easy to wave off. But a cough that lingers for more than 3 or 4 weeks, especially if it's new, changing, or comes with hoarseness, coughing up blood, or shortness of breath, is one of the earliest warning signs of lung cancer. Here's the part that surprises people. Lung cancer doesn't only affect smokers. A meaningful percentage of lung cancer cases occur in people who have never smoked a cigarette in their life, often linked to things like radon exposure, air pollution, secondhand smoke, or genetic factors. So the old assumption of, "I don't smoke, so my lungs are fine," isn't the safety net people think it is. If a cough sticks around long after a cold should have cleared up, that's a signal worth paying attention to, not pushing through. Let's talk about something that's easy to dismiss because it feels so ordinary: indigestion and difficulty swallowing. Almost everyone has had heartburn after a big meal, so when these symptoms show up occasionally, nobody thinks twice. But persistent indigestion, especially when it's new, doesn't respond to usual remedies or is paired with difficulty swallowing food or feeling like food is getting stuck, can be an early sign of stomach or esophageal cancer. The tricky part is that early on, these cancers often don't cause severe pain. They cause this vague sense of discomfort that's easy to explain away with, "I probably just ate too fast," or "it's probably just acid reflux." The signal to watch for isn't the discomfort itself, it's the pattern. Something that keeps happening, keeps getting slightly worse, and doesn't fully go away no matter what you try. For women, there's a cancer that has earned a chilling nickname among doctors: the silent killer. Ovarian cancer often doesn't produce dramatic, obvious symptoms early on, and the symptoms it does produce look almost identical to everyday discomfort: bloating, feeling full quickly when eating, pelvic or abdominal pain, and needing to urinate more frequently or urgently. Individually, every single one of these could be explained by something completely harmless: a big meal, your period, a bit of stress. That's exactly the problem. The warning sign here isn't any one symptom, it's persistence and frequency. These symptoms happening more days than not for several weeks in a row, especially when they're new and don't match your normal patterns. Doctors increasingly encourage women to track this kind of pattern rather than dismiss each individual symptom on its own.
For men, there's a parallel story with prostate cancer, which in its early stages often shows up as changes in urination, needing to go more frequently, especially at night, a weak or interrupted stream, or difficulty starting and stopping. Many men chalk this up to simply getting older, and sometimes that's exactly what it is. Prostate enlargement is extremely common with age and is usually completely benign. But because prostate cancer can present with these same overlapping symptoms, doctors recommend that men, especially over 50 or over 45 with a family history, don't just assume it's aging without at least mentioning it during a checkup. There's one more sign worth talking about because it's so easy to overlook: a sore that doesn't heal. This applies to the skin, but also inside the mouth. A sore, ulcer, or patch inside the mouth that lasts more than 2 to 3 weeks, especially in people who use tobacco or alcohol regularly, can be an early sign of oral cancer. Similarly, a skin sore that scabs over, seems to heal, and then reopens again and again without fully closing is worth having a doctor look at. Our skin and the lining of our mouth are supposed to heal. When they consistently don't, that's the body sending a signal that something underneath isn't functioning the way it should. Now, here's something I want you to notice, because it's the thread connecting almost everything I just described. None of these signs on their own sound alarming. Tiredness, a cough, bloating, a mole, indigestion. None of it sounds like the dramatic, obvious version of cancer we see in movies. And that's precisely the point, and precisely why so many of these signs get missed. Cancer, in its earliest and most treatable stage, is quiet. It doesn't interrupt your life with pain and crisis. It slips in alongside your normal routine, disguised as something ordinary. The skill you need isn't detecting drama, it's noticing patterns, symptoms that are new, that persist for more than 2 to 3 weeks and don't have an obvious everyday explanation.
So what do you actually do with all of this information? First, get to know your own baseline. You cannot notice a meaningful change if you don't have a sense of what normal looks and feels like for your body, your energy, your digestion, your skin. Second, keep a simple mental or written note when something unusual shows up. Not to obsess over it, but so that if it's still there in 3 weeks, you actually remember to mention it instead of forgetting entirely, which is what most of us do. Third, don't self-diagnose using the internet at 1 a.m. And don't self-dismiss either. Both extremes cause harm. The goal is a calm middle path. Notice, track, and if it persists, get it checked by an actual professional who can examine you properly. Fourth, keep up with age-appropriate screenings, mammograms, colonoscopies, skin checks, PSA testing where relevant, because screenings are designed specifically to catch problems before symptoms even appear, which is the earliest and most powerful stage of detection there is. And finally, remember that lifestyle factors, not smoking, limiting alcohol, maintaining a healthy weight, eating a diet rich in vegetables and fiber, staying physically active, and protecting your skin from excessive sun exposure genuinely reduce cancer risk. This isn't about living in fear, it's about stacking the odds in your favor, quietly, every single day. I want to leave you with something a doctor once said that stuck with me. The goal isn't to be afraid of your body, it's to be in a relationship with it, one where you're actually paying attention when it speaks up. Most of the time, when your body sends one of these signals, it really is nothing. A stomach bug, stress, a bad night's sleep, hormones doing their thing. But every once in a while, that whisper turns out to be something worth catching early. And in those cases, the difference between noticing and ignoring can be the difference between a straightforward treatment and a much harder road. You don't need to live anxiously scanning your body for problems. You just need to know what persistent, unexplained, and new actually mean, and take those 3 words seriously when they show up together. So here's what I'd ask you to do after watching this. Not panic, not spiral. Just take 30 seconds right now and mentally scan through the last month. Has anything on this list been happening consistently, quietly in the background? Something you've been meaning to mention to a doctor but keep putting off? If the answer is yes, let this be the nudge that finally gets you to book that appointment.
And if the answer is no, even better. Let this be the reminder to keep paying attention going forward, because awareness like this isn't a one-time thing, it's a habit. Share this with someone in your life who tends to brush off symptoms and push through everything, because sometimes the people who need to hear this most are the ones least likely to go looking for it themselves. Take care of yourself. Listen when your body speaks, even in a whisper, and don't wait for it to shout.